Assessing Carolyn's evaluation report. Okay, so we did a series of assessments on Carolyn, as well as talked to her preschool age teacher, her nurse practitioner, and then the information we gathered from your case history. And we determined that Carolyn is presenting with a phonological processing disorder. And so she's presenting with a series of patterns when she produces sounds, and these are errors. So that's why it's so difficult for her to be understood by familiar and unfamiliar communication partners. So the evaluation determined that she has multiple patterns occurring. So that's why her intelligibility and being understood by others is extremely low. And so we want to address that frustration that Carolyn is having, and as you expressed and as her teacher did as well. Because that's our main concern. We want her to be able to communicate, and we don't want her to be frustrated or cry or feel isolated. But her social interactions and her interactions with school-age children from our play observations were great. She loves to interact. She does a great job. Her social skills are great. Her teacher mentioned that she follows all directions, that she is super sharp, she listens, she interacts in class. So those are all great things that we want to maximize by improving her overall communication. So our long-term goal for Carolyn is that her intelligibility, which is being understood by others, increases in accuracy, especially during times with playtime and her peers and with her siblings. So we're going to maximize that. And we're going to do that by addressing 3 specific patterns and phonological processes. So these are fronting, stopping, and consonant clusters. And these are our main concern because at Carolyn's age, she should stop doing these patterns, but she continues to present with them. And the overlap between her age and not already doing these patterns and the patterns that are normal is why her intelligibility is poor. And that's why it's really difficult for her to be understood by others. So we're going to address these 3 main ones to hopefully improve her accuracy and intelligibility. And so that's our goal. So do you have any questions?
Yes, a couple.
Okay.
Is it something, did I or possibly her mother do something to cause these speech issues?
No, that's nothing to be concerned about. You guys didn't do anything. These are just normal errors that occur. These are nothing that caused, nothing to be, nothing that can't be addressed in therapy. So do not worry about that. Everything is completely fine, and we'll begin addressing these patterns in therapy and intervention.
I have another question.
Okay.
Does the LVC clinical have the experience in dealing with these sort of issues?
Yeah, so LVC, these are things I think a lot of people immediately think of when they think of a speech-language pathologist. So we do have a lot of experience. We have a lot of clinical educators who have worked with children, preschool-age children who present with articulation and phonological disorders. So that's what we're going to work on. We, of course, will go to them for expertise and any questions. Any other questions?
No, thank you very much. You were wonderful.
Great, thank you so much. If you have any questions, please reach out and we will